Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Most of us know someone who has been impacted by sore joints, achy joints, stiff joints, and many times people just deal with this. They just look at it as part of the aging process. Maybe they just get accustomed to taking their NSAIDs on a daily basis, which can come with their own slew of side effects. But I want to talk today about the true impact of arthritis and how many people are actually affected by this and what you can be doing. We know that food matters, exercise matters, but certainly different nutrients that you were taking can make a huge impact as well. I am Amanda Williams, MD, MPH, and today I want to talk all about arthritis. So the Arthritis Foundation came out with their most recent findings and talking about how there's over 100 different types of arthritis. And we know that arthritis itself affects more than 1 in 4 adults within the US. So that's 25% of the population, which is a really large number. Now, what's interesting is that they've done these adjusted estimates to say that close to 100 million adults have doctor-diagnosed arthritis. Now, this is key because you have to keep in mind, many people will deal with arthritis and deal with joint pain and joint stiffness, and they never tell their physician. So it's not technically a diagnosis. It's just something that they deal with as part of their daily routine. And that's a really alarming thing. And we know that there are so many different risk factors when it comes to joint dysfunction. When we look at the natural loss of collagen that occurs, and we know that collagen is the most abundant protein found in the human body, but we also know that as we get older, our collagen stores begin to go down, and they go down in a relatively rapid manner. So they start in going down probably in your mid-20s. And a lot of times people don't like to think about that because you usually don't see the impact, the true impact of low collagen in the body until you're in your 50s or 60s, when you really start to experience more issues such as noticeable fine lines and wrinkles. And you start to notice more stiffness within your joints, which is why it's really advantageous to make sure that you're taking collagen on a regular basis. I always advise at least by the time you're 40 years old, you want to be having collagen as part of a supplementation routine. Collagen is found throughout the entire body. It's not just for the joints. We have to think about hair, skin, the lining of blood vessels. Collagen is critical. Type 1 collagen in particular. But we look at all of these different things that can drive up the greater risk for whether it's collagen wearing away, whether it's inflammation that generates within the joint spaces. We can look at problems with obesity, metabolic syndrome, different chronic disease states that we know can lead you down that path to having a greater risk when it comes to arthritis. So like I said, 1 in 4 adults, there are certain estimates that say 1 in 3 US adults have arthritis. That's an awful lot of people who are dealing with this. And when you look at just the health burden of that alone, and this can really impact how someone's social interactions are. If someone is just always feeling chronic pain, they may not want to go out and do the things that they used to do. Maybe they were more physically active and now they have chronic knee pain or chronic hip pain, and they just don't have that desire to go out and stay as active as they once used to. So this is why it's really incredibly important to make sure that you are doing the right things when it comes to your diet to keep inflammation down, staying away from foods that we know drive up inflammation, and knowing that there are so many different forms in which arthritis can present itself. It's not just osteoarthritis and rheumatoid arthritis. We know rheumatoid arthritis is the autoimmune form, that's when the immune system is actually attacking the joints. But here's an interesting point to make. We also know that osteoarthritis has an immune component to it as well. So while the rheumatoid is definitely prevalent and pronounced autoimmune attack on the joints, we know that osteoarthritis is also being driven by an overactive immune system response. But there's a lot of different other arthritis that we can look at. We can look at psoriatic arthritis. We can look at even sciatica. We can look at spinal stenosis. These are all ways in which we look at arthritis or inflammation that is occurring within joint spaces. So this is why it's really quite important to make sure that you're doing the right things, that you are staying physically active, even if it's very uncomfortable to move around. And this is one thing that oftentimes that I would find myself talking to people about is, yeah, I get up in the morning, my knee is really stiff, but after I move around for about a half an hour, I start feeling better. But then the same thing happens the next day. Now we say, well, wouldn't it be nice if you got to the point where you just got up in the morning and you didn't feel that? Or if you did, it was really, really minor? And how can we go about approaching that? Well, making sure that you're doing the right things with your diet, making sure that you have foods that are nourishing to the body, things that ease inflammation like omega-3 fatty acids, making sure that you stay away from things that are driving up the inflammation like sugar, for example. So these are all things that you can do to make the health of your joints much, much better. We know that there are certain nutrients that can really be beneficial when it comes to joint health. Most of us now recognize the importance of collagen, and type 1 collagen in particular. We can also look at glucosamine and chondroitin. Now, these have been around for so long, and people have talked about it for a very long time. I remember being a little girl and hearing about people taking glucosamine and chondroitin supplements for their joints. And for some people, they may find taking glucosamine and chondroitin is not as helpful as taking hyaluronic acid or taking curcumin, for example. But what it comes down to is, what type of arthritis do you have? What's driving this? And then taking the right nutrients to really support you. Now, there was a really important meta-analysis that was conducted a couple of years ago through the Journal of Orthopedic Surgery and Research. And I think it's something that most people are unaware of, that how much clinical research goes in to looking at things like glucosamine and chondroitin. And this particular meta-analysis, they were looking at all of these randomized controlled trials of glucosamine and chondroitin, just how effective they are when it comes to alleviating pain symptoms as well as improving functionality within the joint. And they found that glucosamine significantly improved the joint functionality when you talk about the stiffness of the joint. They found that the chondroitin also was very, very powerful when it came to alleviating pain symptoms as well as improvement of the function. And they were looking at all of these different clinical trials. So they looked at 30 different trials, these meta-analysis of these double-blind placebo-controlled trials, and they found just how powerful supplementation of glucosamine and chondroitin really was when it came to the way that the body responds. Now, what in the world is glucosamine and chondroitin? Well, we know that chondroitin is this major component of cartilage that helps to retain water, which is important because when we talk about the joints, you have the tendons, you have ligaments, we have the bone, we have muscles. But you have to understand that each of these areas are reliant on certain factors. And we know that chondroitin helps with that mobility aspect. It's allowing that cartilage to remain in that hydrated state. We know that chondroitin itself is made in the body naturally. But one of the things, as with so many other things in the body, our natural production can diminish over time. So as we get older, our natural production of chondroitin will begin to diminish. And then we look at glucosamine, and this is much like chondroitin. This is this natural compound that is found within healthy cartilage, particularly found within the fluid around the joints. And we know, once again, that it plays this really important role in terms of easing inflammation as well as helping for cartilage regeneration. So this is all really important stuff. Now, there was a study that was done where they were looking at chondroitin as being as good as NSAIDs when it came to knee arthritis. Now, this is huge because remember in the beginning I said a lot of people will go off and they will take different NSAIDs, so different ibuprofens and different types of over-the-counter medications to target the pain within the joints. But with those come certain side effects. We know we have to monitor and look at kidney function, liver function when you are taking these things long term. There's always the concern with ulcers if someone's taking high amounts of things like aspirin, for example. So we look at chondroitin. We say, okay, what is chondroitin? Well, this is something that the body naturally makes. And we know that that level goes down as we get older. But there is this study that came out of the Annals of Rheumatic Diseases that looked specifically at supplementation of chondroitin and finding that that was just as effective for knee osteoarthritis as the COX-2 inhibiting drug Celebrex. That's some powerful stuff there. Understanding that taking chondroitin could be as effective as taking this very powerful COX-2 inhibiting drug. And many people know the potential side effects that go along with Celebrex when you think about the cardiovascular system and the potential for taking Celebrex driving up an increased risk of a cardiovascular event. Well, we're not finding that, obviously, with chondroitin. So in this study, they were giving patients who have osteoarthritis of the knee. This wasn't a small study. This had hundreds of men and women in it. And they gave them 800 milligrams of chondroitin every day for 6 months. And they looked at how they responded to that. And over the course of that trial, they found a significant shift, not only in the perception of pain within the joint, but also in the functionality. So we know these things. And this is why people oftentimes will say, oh, glucosamine and chondroitin, very beneficial for the joint. And indeed they are. But here's another interesting thing that many times people don't realize. When we think about glucosamine and chondroitin, of course we think about joint health, but we also have to recognize the other systemic benefits that go along with taking glucosamine and chondroitin. In the American Journal of Clinical Nutrition, they put out the findings from University of Washington School of Public Health and the Fred Hutchinson Cancer Research Center, showing that men and women between the ages of 50 and 76 years old who were supplementing with glucosamine and chondroitin for a period of 10 years had a significantly lowered risk of mortality, so dying of any cause. They said that what they were able to determine was that the chondroitin and the glucosamine actually was inhibiting NF-kappa beta, this major driver for inflammation that has been associated with things like cancer and inflammatory diseases. So they said glucosamine and chondroitin actually have anti-inflammatory properties to them. So it's not just about the maintaining of the hydration within the joint. It's not just about maintaining the cartilage and regeneration of the cartilage. We now know that the glucosamine and chondroitin can actually do so much more. And looking at markers for inflammation, recognizing that those who supplemented with glucosamine and chondroitin had CRP levels, C-reactive protein levels, this marker for inflammation, that were close to 20% less on average than those who did not use glucosamine. This is really impressive. And when it came to chondroitin, they found that the CRP levels were down by over 20%. So when you combine the two and you say, okay, if I take glucosamine and chondroitin, I'm really targeting inflammation throughout the body. Understanding all of that. They have so many clinical trials looking at the impact of the NSAIDs and the COX-2 inhibitor Celebrex, looking at the potential side effects that go along with that. And they did this randomized double-blind trial called MOVES, where they took men and women who had knee osteoarthritis, and they found, once again, that the combination of glucosamine and chondroitin yielded a significant analgesic effect. So pain medicine. So it helped in terms of pain, but also, once again, with the functionality without looking at those potential side effects that we know go along with those NSAIDs. So knowing that we have 1 in 4, if not 1 in 3, U.S. adults dealing with some form of chronic joint pain or joint dysfunction, knowing that our collagen levels go down once we hit 25 and the important role that collagen plays in joint health, knowing that the body starts to diminish its ability to produce chondroitin as we get older, it makes sense that when we think about a joint health regimen, that we incorporate and we include nutrients such as collagen, such as glucosamine and chondroitin, and recognizing the power of glucosamine and chondroitin beyond that of just the joint health, understanding how much of an impact those two nutrients can make when it comes to targeting systemic inflammation is a really, really powerful thing. So that is all that I have for you for today. I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Now, do make sure that you subscribe and leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health, and we will see you next time for another episode of the Invite Health podcast.